This case was in a high school aged youth, and the individual had no other health issues whatsoever. We were able this week, in partnership with the Office of the CMOH, to confirm that the case is meeting the national working case definition of severe pulmonary illness associated with vaping. The individual is a high school aged youth. They had quite a severe illness course, including ICU life support. The individual recovered and is now at home. This case was carefully investigated by our local physicians, and there was no other cause, no infectious cause, no hint of any neoplasm cancer, no other immune-related issues. The only issue that was identified was that the individual vaped e-cigarettes. In Canada, where youth smoking rates have been low and dropping for many years, what happens is the reverse. You start people on that smoking-related behavior, and in particular, the e-juice contains high amounts of nicotine, making it very addictive. So in that situation, you're actually getting people addicted to a product. Then, when they run out of money, because it is very expensive, cigarettes are much cheaper, and you start to see that smoking behavior start up. So that's the concern that we see in Canada, where we previously had low rates of youth smoking.
I mean, I'm really disturbed to hear any time that a product on the market is causing illness. I think we've got to be very careful in making sure we've got evidence. We make an evidence-based decision around any new product to make sure that we're first and foremost making sure we protect Canadians, giving them the information around what's safe and what's not. It's our job as a government, as a country, to make sure we do all the testing appropriate and make sure people are aware of what the risks are. And if something is risky to someone's health, that's not allowed on our market.
We recognize that vaping can also be used as a harm reduction measure as well. So we also have to keep that in mind. But at the end of the day, my number one priority is protecting our youth, and we certainly want to make sure that the regulations that are in place will be protecting our youth and making sure that these products are not appealing to youth in any way.